In 1869, ALS was discovered by French neurologist Jean-Martin Charcot. It wasn't until 1939, when Lou Gehrig was diagnosed with the disease, that it was brought to the attention of the nation. ALS attacks the brain's motor neurons, which causes muscles to twitch, become weakened, and slow their reflexes. Once ALS has reached the spinal motor neurons, patients lose control of limbs and will eventually become paralyzed. Eventually, ALS will affect enough motor neurons that the muscles that control breathing stop working and the patient will no longer be able to breathe. ALS slowly causes the degradation of motor neurons that control voluntary movements such as walking, chewing, and even breathing. Because movements like the heart beating and the digestion of food are involuntary, ALS does not affect these functions of the body. The motor neuron degradation will eventually lead to complete paralysis and later to death in all ALS patients. There is little known about the cause of ALS, but researchers have found that ALS is mostly passed through genetics, but anyone can be affected. There are around 5,600 people diagnosed with ALS each year in America, and the average age of these people is 55, but there have been many cases involving people in their 20s. Men are 20% more likely to contract the disease than women. There is still much more research to be done to actually figure out what and why people get ALS. The only pattern that researchers have noticed so far is that Gulf War veterans are almost twice as likely as anyone else to get the disease. Early signs of ALS include difficulty walking and/or performing normal daily activities, muscle twitches, weakness in extremities, difficulty swallowing, and trouble maintaining normal posture. Most of the time, no involuntary bodily functions are affected by ALS. Once the motor neurons begin to degrade, muscle functions will start to be lost altogether. All ALS patients will become wheelchair-bound at some point, and all will suffer from total paralysis. Once paralysis occurs, patients will need a permanent ventilator to breathe. In these later stages of the disease, the ability to swallow and breathe are almost impossible. Sadly, this will eventually lead to the death of the patient. Death from ALS is always guaranteed, with most patients living only 3 to 5 years after being diagnosed. Although ALS has been around for almost 150 years, there is no cure for the disease. The medication Ralotech is one of the only known drugs to extend the lifespan of those suffering from ALS and sometimes helping them to decrease their symptoms. This chart shows patients taking a placebo versus those taking Ralotech. Patients taking Ralotech had a slightly greater chance of survival than those taking the placebo. In many cases, the treatment goals for an ALS patient is mainly to help them cope with the disease and stay as comfortable as possible while they are alive. Equipping the patient's home with proper means of inside transport, as well as providing them a safe way to get out of the house, is very important. Occupational therapists and physicians will work together many times to make sure that the patient is completely satisfied with the care that they are receiving.